Good afternoon, and thank you so much for joining our webinar this afternoon. My name is Roshni Devchand, and I am the Director of Education at the Cancer Support Community. For those joining for the first time, I'd like to share a little bit about the Cancer Support Community. We are a global nonprofit dedicating to uplifting and strengthening people impacted by cancer. Our mission is to foster connection, compassion, and knowledge through professionally led psychosocial support, navigation services, healthy living programs, social connections, and our award-winning education series, Frankly Speaking About Cancer. These services are offered at more than 200 Cancer Support Community, Gilda's Club, and network partner locations, as well as online through our toll-free helpline. When you connect with us, you are supported by licensed community navigators and resource specialists who provide patient navigation, financial counseling, CAR-T concierge services, genetic and biomarker counseling, clinical trial and pediatric support, and much more, all at no cost. For over 40 years, we have been a relentless ally, helping individuals and families manage the realities of this disease and reclaim a sense of normalcy. Today, we're going to discuss eating concerns and tips for patients with multiple myeloma. We partnered with the Multiple Myeloma Research Foundation and Savor Health to better understand the unique experience and challenges of managing eating concerns during cancer treatment. I'd like to share a little bit more about these partners. The Multiple Myeloma Research Foundation is the largest nonprofit in the world solely focused on accelerating a cure for each and every multiple myeloma patient. The MMRF provides a wide range of services that educate and support myeloma patients and caregivers. These include patient education programs with myeloma experts, clinical trial matching, and a comprehensive online education hub. The MMRF also offers personalized navigation from clinically trained oncology nurses. In addition to these patient-focused services, the MMRF funds research and sponsors clinical trials and observational studies to accelerate the development of new myeloma therapies, advancing its mission to find a cure for every patient. Savor Health provides on-demand, personalized, evidence-based nutrition support to help people manage or prevent diet-related chronic conditions through its expert platform, which has been validated by 2 IRB-approved clinical trials. INA, the Intelligent Nutrition Assistant, was built by medical and data science professionals and includes hundreds of thousands of peer-reviewed, guideline-based interventions. I am extremely grateful to have with us today an experienced oncologist, a skilled registered dietitian, and a cancer survivor and patient advocate. We're going to bring our speakers into that now. We're joined today by Dr. Craig Cole. Craig Emmett Cole, MD, is a board-certified hematologist who received his Bachelor of Science degree at Michigan State University, his doctoral degree at Ohio State University College of Medicine, and completed his residency and fellowship at the University of Michigan. Dr. Cole conducted laboratory research at the Jerome Lipper Multiple Myeloma Center of Medicine at the Dana-Farber Cancer Institute. He was subsequently an attending hematologist at Gundersen Health System University or Wisconsin School of Medicine in La Crosse, Wisconsin. Dr. Cole then returned to the University of Michigan Rogel Cancer Center in Ann Arbor, Michigan, before returning to Michigan State University in 2019. Dr. Cole has expanded his work in myeloma research and clinical care at Karmanos Cancer Institute in Detroit and as an associate professor at Wayne State University, as well as seeing patients in Lansing, Michigan as a clinical associate professor at Michigan State University. Thank you so much, Dr. Cole, for being here with us.
Oh, thanks for the invitation. I really appreciate it.
We are also joined today by Chelsea Schneider. Chelsea Schneider is a registered dietitian and certified specialist in oncology nutrition. Chelsea works with Savor Health, a digital health company that provides tailored nutrition guidance to optimize health outcomes through a digital, clinically validated platform, INA, the Intelligent Nutrition Assistant. Chelsea is passionate about turning science into actionable goals for her patients, helping them integrate clinical guidelines into easy everyday lifestyle actions. Chelsea has her bachelor's and master's in nutrition and holds her advanced practice certifications for over 10 years, gaining extensive clinical experience working with the oncology population. Thank you so much, Chelsea, for being here with us.
Thank you.
And we are also joined today by Michelle. Michelle was diagnosed with multiple myeloma in December of 2022 after 3 months of confusing symptoms of back pain, shortness of breath, and extreme fatigue. By mid-December, she began a 4-drug treatment called DRVD, to which she fortunately responded very well. 2 months later, another bone biopsy showed no trace of multiple myeloma, and her stem cell transplant was scheduled for May. It took approximately 1 year after the stem cell transplant to begin to feel normal again. Michelle's strength gradually returned, allowing her to increase her activity levels. The back pain had mostly resolved and she was able to take longer walks and manage her household chores. However, it was almost another year before she resumed rigorous workouts, gardening, and felt strong enough to work and travel again. She had been very strong and healthy before her diagnosis, exercising and eating well, which she's believed has helped in her recovery. It was difficult to maintain healthy eating during those first 2 years of treatment, which is what we're going to be talking about today. Again, thank you so much, Michelle, and to all of you for joining us today.
My pleasure.
I also want to say we're grateful for the support of Johnson & Johnson and the partnership with the Multiple Myeloma Research Foundation and Savor Health in bringing you this webinar about eating concerns and tips for patients with multiple myeloma. Let's go ahead and dive in, and I'd like to start by talking about a broader understanding of multiple myeloma. Dr. Cole, can you please start off by describing to us what is multiple myeloma, including some risk factors and signs and symptoms?
Yes. So myeloma is a cancer of the plasma cells. So the plasma cells are part of the immune system, part of the white blood cells that live inside the bone marrow. And just like any other cell in the body, just like, a lung cell or a pancreas cell that can become mutated and become cancerous, the plasma cells that live inside our bone marrows can become cancerous. And when they become cancerous, they can do some interesting things. One is that they can crowd out the rest. The bone marrow is your blood factory, so it begins to crowd out the normal bone marrow, causing low blood counts. And when people have low red blood or they have low blood counts, they can feel really tired
Dr. Cole,
and
are you there?
exhausted. The myeloma cells do. And so when they become, oh, I'm sorry.
You're good.
Oh,
We paused
oh,
for a second, but go ahead.
Oh,
Thank you.
when they become malignant, then they can cause the bones to thin and eventually break. So back pain is one of the very first signs and symptoms of multiple myeloma because those plasma cells can cause thinning of the bone. They can also cause high calcium levels by causing bone erosion and causing the bones to kind of wear away and thin out. It can cause high calcium levels, which can cause fatigue and cause confusion. And then finally, one of the telltale signs of myeloma is that those plasma cells will produce antibodies. They'll produce not antibodies that can help fight infection, but antibodies that actually lower the immune system, that crowd out the normal immune system, which can cause people to have excessive numbers of infections. And that protein we call a monoclonal protein or M protein or myeloma protein can be detected in the blood as a way to find the cancer, but that same protein can get caught in the kidneys, causing kidney damage and sometimes kidney failure. And so we have an acronym for that called CRAB, with C being the high calcium levels, which can cause confusion and fatigue, the R staying for renal or kidney damage, causing weakness and fatigue, the anemia causing weakness and fatigue for the A, and then B, the bone damage or the holes in the bones, lytic lesions, causing pain. It takes longer to diagnose myeloma than most other blood cancers because fatigue and feeling tired and having back pain can masquerade as a bunch of different things, which is why we try to tell doctors and people to really be thinking about myeloma when people have those symptoms. Some of the risk factors for myeloma, well, you basically always see it in older people, I mean, over age 50. You never see myeloma in kids. And also people of African descent have twice the incidence of myeloma as other groups. Men are also more likely to have myeloma, But other than some of those risk factors, we really haven't identified a lot of things that cause myeloma, and that's an active area of research that's going on currently.
Thank you so much, Dr. Cole, for that description. And Michelle, I saw you nodding along because I think a lot of the symptoms that Dr. Cole described are what you had experienced. Can you tell us a little bit about your experience when you were first diagnosed?
Absolutely. It was so strange. It happened suddenly, the back pain. I was literally sitting in a chair and I turned and I heard like a crack or a pop and then had extreme back pain. I saw my primary care doctor 3 times for the back pain. We had an MRI. They didn't see anything. Then I had this strange, I know now it's called shortness of breath, but at the time it just felt like every time I tried to talk, I would cough. So they gave me antibiotics thinking it was bronchitis. They sent me to a pulmonologist and he had me start doing nebulizer treatments. And finally I went to a friend's doctor. My friend dragged me and said, "You've got to go see somebody else." And he looked at me. At this point, I was like barely functioning. I don't know how I was. And he said, "I think we should draw some blood." And he saw the high calcium and sent me to a hematologist right away. So it was just a very strange journey.
Thank you so much for sharing your experience, Michelle. And you mentioned you saw a few different doctors. What was the best way for you to kind of continue to advocate for yourself and find the right doctor who would listen and hear your symptoms?
I just think that the people around me were more the advocates saying something's wrong with you. I would always, "Oh, I'll feel better tomorrow. I tough through it. I'll get better." I just thought it was something that would get better. You never think
Mhm.
it's cancer because it's not how you expect cancer to manifest. So thank goodness my family and my friends were like, "No, you're going to keep going." So
But Rashi, that's actually a very typical, presentation for myeloma. And so it usually takes about 4 to 6 months from the time that people have some of those symptoms to when they actually get diagnosed, which is months long than it is to diagnose other cancers.
mm,
Which is why we're, putting out so much effort to try and educate primary care docs, to think about this disease, and because it's really easy. It's two blood tests diagnose 99% of myeloma. And really those two tests are only specific for myeloma. So it's really easy to diagnose. We just have to have people to think about it.
Yeah, those are great points. Thank you so much, both of you, for sharing. I want to move to talking a little bit more about the treatments and the side effects. So, Dr. Cole, what are the typical treatments or some of the slew of treatments that are commonly used to treat multiple myeloma?
Yep. And very broad. Thank goodness we have a lot. So that's a good thing. And they're kind of broken down into two groups. One is the induction therapy. When someone is first diagnosed, how do we start treating them right off the mat? Because our best shot at controlling the disease is when it's newly diagnosed. So that we use immune therapy and targeted therapy. So, the 4 drug regimen that you had mentioned that Michelle had received includes an immunotherapy drug, which is an antibody to get the body to attack the myeloma. And then we use an immunomodulatory drug, which helps to stimulate the T cells and stimulate the immune system to attack the myeloma. We use a proteasome inhibitor. So what's a proteasome inhibitor? Well, it stops up proteins inside of cells. What do myeloma cells produce? Lots of protein. So if you can stop those proteins inside the cells, then they pop out like a balloon. And there's no other cell in your body that's doing that. So again, very targeted therapy for myeloma. And then we add the dexamethasone, the steroid. We've been using dexamethasone longer than any other drug, and we use that to also augment the effect of the other drugs. So those are the 4 drug regimens. We follow that then with chemotherapy, with a stem cell transplant, um, that Michelle had received. And that's one big dose of chemotherapy to wipe out any cells, any myeloma cells that the initial therapy didn't get. And then people are on maintenance therapy, which is usually just 1 or 2 drugs, no steroids at all. And people are on that for very, very long periods of time. When people relapse, then sometimes we use different drugs in the same categories that I've mentioned. But what's new and upcoming is using the T cell redirection therapy. Because we know those T cells will kill cancer cells if they can find the cancer cells. And so therapies like CAR T and the bispecifics are therapies that help get those T cells to find the cancer cells and destroy them. Sometimes they attack other cells that we can talk about a bit later that can change the appetite and some of the taste sensations. But really, immunotherapy and T cell redirection is the cutting edge of myeloma therapy right now.
Thank you so much for sharing that. And yes, it does sound like, an evolving space with treatment options continuing to expand for patients to best meet their needs. Michelle, could you tell us a little bit about the treatments that you received?
I did the 4 drug treatment, and then they call it the stem cell transplant, but that's just like the recovery part of it. It's really just a huge dose of chemo, and yeah, it's not fun. You're weak. You're really weak for about a month, and then they put your stem cells back in you to help you recover and start getting stronger again. Um, and then now I'm just on one drug, Revlimid, as a maintenance therapy.
Got it. Thank you so much for sharing that. And I know you've mentioned, Dr. Cole, you just mentioned as well, some of these treatments come with some pretty significant side effects, particularly around eating and nutrition, that can make some things challenging. Can you talk a little bit about some of these side effects that patients may experience when they're going through treatment for multiple myeloma?
Yeah, it's kind of all over the place. I mean, it goes from, from fast to famine. So the dexamethasone that we use with myeloma therapy, I would say, and I think my patients would say the Dex may be, even though it's the oldest, therapy that we have, even though it's the same Dex that you get when people have, asthma attacks or they get into poison ivy, dexamethasone can really increase the appetite, make people kind of hyper anxious at times. And so we have patients that will gain weight while they're on dexamethasone, which is why there's lots of studies showing that we need to reduce those dexamethasone doses. As soon as we get a response, to lower those dexamethasone doses as fast as you can, because it can also cause things like muscle weakness, diabetes, high blood sugars, and so it can really affect things. Then on the other side, Michelle had mentioned the stem cell transplant, which has, which can have, and that's why people are in the hospital for it, nausea, vomiting, and really not having an appetite for actually, a month at a time before they can regain their appetite. So you go from eating too much to not eating enough with stem cell. And then but on maintenance therapy, things even out. But with relapse therapy and particularly with, CAR T and with the bispecific therapy, then we're reintroducing some of the dexamethasone back, and then you can have definite taste and changes, specifically with one of the bispecifics. That's called a GPRC5 bispecific. GPRC5 is on myeloma cells, so that bispecific will kill myeloma cells, but they're also on skin cells. And the skin cells, you can have dry skin, you can have nail changes, but it can also change your sense of taste, your sense of smell, and really decrease your appetite and have quite a bit of weight loss initially with that drug. And so again, it's kind of all over the place, but the good thing is that it's very predictable. You know which drug causes which side effect, and therefore you can anticipate those problems. And so one thing that we do is we get interventions and those changes early on, sometimes even before they start therapy, so that we know what to expect and we know how to deal with it before it gets to be a real problem.
That's great to hear. And we talk a lot about at the cancer support community about how education is empowerment, and knowing what to expect can really help patients have that proactive management to talk to their care team about how best to manage some of these potential side effects. So thank you for sharing that. And it does sound like it's a little bit all over the place. And Michelle, would you mind sharing a little bit about what your experience was with side effects for your treatment?
I think the main thing is extreme fatigue. And I don't know whether that was just the disease or also the treatment. I think it's a little bit of both. Um, GI issues, there's definitely constipation in my case. And one thing I have to say is when you're taking all these medicines, I had a tendency to attribute anything I felt to, oh, it must be a side effect. So I kept having these, what I would call like attacks. And I thought like stomach attacks. And I thought, oh, it's probably the Revlimid, whatever. Well, it took a year and a half until finally they said, no, it's your gallbladder. And I didn't think, oh, I could have something else while I'm going through this that's causing this. So just be careful. Like when you have something, I think you have to advocate for yourself. Like, this is not good. Every month or every couple of weeks, I would be in pain for like 10 hours waiting for this to go away. And I thought it was just a side effect of the medicine. The brain fog is to me one of the worst side effects. And I think I still get that when I'm on the Revlimid. It's just what happens. So I'm luckily I'm only on it 2 weeks on, 2 weeks off right now. So I'm smart half the time and a little out of it the other half. But that's probably the worst. And those decks, when you're taking that, I got mean and I feel really bad. And I had to apologize to my family because it was like when they talk about roid rage, I felt that for sure. Yeah.
Thank you so much for sharing, and for sharing about, needing to advocate for yourself when you are experiencing new symptoms or different feelings, because it just, elevates that point of really needing to talk to your care team when you experience any new signs or symptoms, because needing to know whether that is a side effect or some other sort of sign is really important. And thank you for mentioning how you advocated for yourself and talked through those different signs and
Yeah.
symptoms
I
during
mean,
your own experience.
I mean, research that you guys had done with the patient experience survey in myeloma, showed that I think it was like 36% of only 36% of myeloma patients actually told their doctor they're having side effects from some of their drugs. And part of the reason that they didn't is that they thought, well, there's nothing they can do about it anyway. We've been giving these drugs for, years, decades in some situations, and so we know what the side effects are. We know even the weird side effects. It's been around for so long. We know exactly what to anticipate. So I would definitely say if you have anything that happens, anything that's different, to let us know, because with these drugs that we have been around for a while, we kind of know what to expect and
Yeah.
how to solve it.
Such an important point. And I did want to flag that in the chat, there's lots of great resources that are being posted, including resources about how to talk to your care team about signs and symptoms and the things to kind of look out for and questions to take to your care team. So definitely take a look at those resources for all of our attendees as well. So let's shift gears and talk about more about these eating challenges that come with treatment for multiple myeloma. So Chelsea, I would love to ask you this next question. Can you talk a little bit more about the specific eating challenges and nutrition concerns that may result from treatment for multiple myeloma?
Yes. As Dr. Cole and Michelle have shared with us, there are different extremes of what patients can experience, but I really like Dr. Cole how you highlighted that it can be predictable. So working with an oncology dietitian, if you have one on your team who's part of the myeloma clinic, can really support and guide you through, okay, this is what your treatment is. These are the side effects that we think you'll most likely have, and this is how to manage them. So really working with your team who is knowledgeable and can help you and say, if you're on dexamethasone and you're having an increased appetite and you're trying to manage that, because it really is an increased appetite. You're hungry all the time. You're eating and you're not satisfied. And that is also an uncomfortable feeling, you know, in addition to the other extreme of having no appetite and no internal desire to eat. So if you're having an extreme of, a very large appetite, as a result from the steroid, working with a registered dietitian to create a meal plan, something like maybe smaller, more frequent meals that are high in fiber and protein, high in healthy fats, things that are going to increase your satiety. Having very, very balanced meals so that you have your fat, your protein, and your fiber, things that are going to make you feel more satisfied. Having, healthy snacks on hand that are going to have those fiber and protein components as well, making sure you're staying hydrated, and then that other extreme of managing no appetite, having no desire to eat, could look really similar. Again, having kind of those small, frequent meals, but maybe you're having some comfort foods, easy to tolerate foods, high calorie and high protein foods if you're only finishing, 50% of your normal meal. So working with a dietitian to help you create these, menu plans and meal ideas that might not come to you if you're, so hungry and nothing is really appealing to you, or the opposite, if you're not hungry at all and nothing sounds good. And then also working through those other eating challenges like nausea, vomiting, constipation, diarrhea. Dr. Cole, I think you mentioned like, or maybe Michelle mentioned, you kind of are told to expect, okay, these are the side effects that you're going to have. But nutrition intervention can really help when managing things like constipation and diarrhea specifically, modifying the amount of fiber that you're eating in your diet, choosing soluble fiber, which acts like a sponge if you're having diarrhea, and limiting insoluble fiber, which, is a stimulant, and then doing the opposite if you're having constipation. So getting educated on all these different factors and really like which foods to eat and which foods to avoid based on how you're feeling can be super helpful and really empower patients to say, okay, I know I might, be prone to diarrhea right now, but this is what I can do at home, how I can modify my meals. I can cook my vegetables instead of eating salads. I could take the skins and the seeds off if I know I'm going to have or be more prone to having diarrhea. And just all of these modifications can really help the patients to kind of take control over managing their side effects at home.
That's a lot of really great information. Thank you so much, Chelsea. And it sounds like, like you and Dr. Cole both said, knowing ahead of time what some of these challenges may be can really help to manage them. Is there anything, and this is for both you, Dr. Cole and Chelsea, is there anything that patients can do ahead of time before they start treatment to really manage some of these potential side effects?
One thing that is like the best, I mean, Chelsea said a bunch of like fantastic things, but one of the best things she said is take control. And my wife's a dietitian, and how we met was she told me how really, what your nutritional status is and being involved is a source of empowerment for patients. This is how you empower yourself. This is how you have complete control over what you eat, and the decisions that you make. I don't, because I'm not at the grocery store with you, but this is something that is your form of control. And if you're in control, if you're driving the ship, you want to have some knowledge to drive the ship. And that's why the dietitians are so important to get involved early in the disease and when you're changing therapies from one to the other. You don't have to marry one like I did, but but I think having them involved early. So, when I just spoke to a patient today about changing her therapy to the one drug that can cause changes in sense of taste, and weight loss. And so the next step is she's going to meet with our dietitian in order to see what can we do proactively to take control, not let the drug control us, but we take control of the drug and have it fight the myeloma and keep ahead of the side effects.
Great points. And I think, oh, sorry, go ahead, Chelsea, please.
No, absolutely. I was just going to echo what Dr. Cole said, that early intervention and education is one of the best things that we could do for our patients, to help them, as Michelle mentioned, the brain fog that might set in when you're going through treatment. Getting patients that education before they're starting to feel sick, so that they can stock up on the appropriate foods that they may need. Maybe, set up their freezer with some meals that will be appropriate for them and easy to prepare and take out of the freezer. So just getting ahead of it could be really so helpful.
Great points from both of you. Thank you. And I think both of you highlighted in that in terms of taking control of speaking to your care team and making sure that utilizing the resources available to you, whether that's working with an oncology nutrition specialist and working with your care team, working with your doctor to manage all of those things together and make sure that everybody's working as one team to support you, because that's what they are there to do. Michelle, I would love to turn it to you and hear a little bit about the eating challenges or some of the experiences you had when it came to your daily meals when you were going through your active treatment as well.
At the very beginning, once I finally got diagnosed, I was very sick. I moved in with my parents. Thank goodness I had them. They're both in their 80s. Um, so I could not get out of bed without them helping
Mm.
me. I could not stand to cut up vegetables. I used to cook everything for myself. And so I was out of control over what I ate. And that was very interesting, Dr. Cole, when you said that, because it took almost a year before I was well enough to feel back in control of that. But during that time, I mean, they would get me whatever I wanted. I tried not to be a burden, but it was a lot of comfort food. Man, toast with butter. I never ate that before, but when I was sick, that was like my go-to, and eggs. And for dinner, mom always made like chicken and vegetables and potatoes, healthy stuff. You eat a lot of soup. So, yeah, I think that you lose control at first. And I think that my diet at that point was kind of the last thing I was thinking about. I knew that it was important. And then you hear scary things like sugar feeds cancer, animal products feed cancer. And I'm thinking, oh, I can't become a vegan right now. You hear scary things, and every time you take a bite, you're like, am I feeding my cancer? So I don't know if you want to address that, Chelsea, because that was scary at the beginning for me.
Yes, that is a very important point. So just like we were talking about the different like extremes of how a patient might feel while they're going through treatment, there are different kind of focuses of nutrition as a patient goes through the cancer continuum. So while they're on treatment, managing side effects and optimizing nutrition is the absolute most important thing. So in you could tell a patient, eat whatever you want as long as you're eating is really the truth. And, shut out all the noise about sugar and cancer and meat and everything else. And sometimes it's just about eating your comfort foods and, scrambled eggs and toast with butter and a milkshake if that's what sounds appealing. It really doesn't matter that it has dairy or sugar in it. It's so important to get the calories and the protein that you need. If you're getting the calories and the protein that you need, you'll be able to tolerate your treatment better, stay on treatment better. All of that can help to support your blood counts. It's not the only thing, but it can help. And really, then once you're in the post-treatment phase, maybe in the maintenance phase and only managing one drug, start to focus on the research about plant-based diets being healthy for preventing cancer recurrence. But just really focusing on the part of treatment that you're in and what is most important at that time.
Sugar does. The other reason I married my wife, I mean, I love my wife, but when she said, and it is a truth, that sugar does not feed myeloma. Your sugar helps your body, sugar helps your brain. Your brain only works off of sugar, but sugar does not feed cancer. It is cancer that feeds cancer. And so what can you do to take control? When people say that, it really is, a cry for help and taking control. And it's really easy to say, I'm going to eliminate this one thing from my diet to take control. When really you can take control by A, getting educated, seeing a dietitian, and then being mindful about what you eat and making sure that you have, especially when you're in treatment, calorie-rich foods. When I see a patient going through stem cell drinking a glass of water, I was thinking, you could just put a little bit of lemonade instead, and that calorie poor thing goes to something that's calorie rich that can then help them maintain their weight and everything like that. But sugar, your brain eats sugar. That's true. Cancer does not eat sugar. That's false.
Thank you both so much. Thank all three of you for sharing all of that and talking about the different kinds of foods that can work well for patients who are going through treatment. And I love what you said in that making those decisions is all about feeding the body so that you can tolerate the treatment, right? That getting the nutrition so that the patients can tolerate the treatment. And Michelle, you had mentioned the comfort foods that really were helpful for you, the soups and the toast with butter. Were there other foods or drinks or flavors or textures that really were helpful for you in those moments when you knew that you needed to eat and feed your body?
Toasted cheese sandwiches, really good. I think that if I never have Gatorade again, it will be too soon, because when I had renal failure, I was in the hospital and they were like, oh, you have to drink 72 ounces a day, which is a lot. I would dilute Gatorade just so that I didn't have just plain water, and I couldn't tolerate it after a while. It was just like a month of Gatorade. So I don't know. I'm pretty good about food. I like pretty much anything, so nothing really was bad. I didn't have any taste issues.
So let's shift gears and talk a little bit more. I know we've been touching on some tips for eating challenges, but would love to dive into that a little bit more. And Chelsea, are there some practical food swaps or cooking strategies or modifications for people that may be struggling to eat during or after treatment?
Yes, and it really depends on the specific side effects that patients are having, but to try to generalize it, if someone's experiencing taste changes, the registered dietitian should work with them to try to identify what types of taste changes. Taste changes can be loss of taste, metallic taste, salty food tasting very, very salty, sweet food tasting very, very sweet, and then working based off of that. If there's a metallic taste, avoiding metal utensils, which seems obvious, but sometimes we don't think of it, and using plastic or another type of variety of utensils, and then adding flavors to food based on those other taste changes that you might have. There's an acronym FASS, which stands for fats, acids, salts, and sweets, and are different ways that you can change the flavor of your food based on the taste changes that you're having. Fats, using fat as a vehicle for flavor, like olive oil or a little bit of butter or ghee or coconut oil. Acids, as long as you're not experiencing mouth sores or any mucositis, using a little bit of lemon juice to bring out the flavor of chicken, fish, or even soup before eating it if it's tasting a little bland. And then salts and sweets are pretty obvious, using a little bit of salt, obviously being mindful if you're having any kidney issues or hypertension, ascites, and then a little bit of sweets. I remember when I was working in the hospital, I had one patient who would always eat oatmeal and yogurt for breakfast, but it just was not tasting good for them. So they would add a tablespoon of maple syrup into their oatmeal yogurt combination, and it made it delicious. So just that small addition to their breakfast, using these different ways to flavor foods can really help. And then based upon any other side effects that our patients might be having, kind of modifying your diet using these methods to either change the ingredients, the flavors, or even the textures to help manage the side effect.
Those are great points. Thank you so much, Chelsea. I really appreciate it. And I know we've talked about, these different tips for what to eat and the kinds of foods maybe to avoid or to kind of adjust diets. But another important tip for eating well while going through treatment is really getting the support that you need as when you're going through that treatment. And I know, Michelle, you talked about your parents being a wonderful support system for you and helping you kind of maintain your nutrition as much as possible. Can you talk a little bit more about the importance of a strong support network when you're managing those eating challenges during treatment?
Absolutely. And I think that I can't say it strongly enough, reach out to people, because I did have, my sister would cook at least twice a week to give my parents a break, and she'd bring over things. I had friends bringing food over, and people want to help. And if you tell them what you want or what you need, it makes them feel good. And I probably didn't do it as much as I could have or should have. But I was fortunate to have my parents there. But especially if you know, are used to living alone and you need that support, you definitely should reach out, and people will gladly support you.
Thank you so much for sharing that. And we have a lot of caregiver and support resources on the Cancer Support Community website. We also have a helpline that is staffed with patient navigators and other support system people who can help you, as well as there are patient navigators and support systems in place at hospitals and healthcare centers where people receive treatment. So definitely, second what Michelle said, reach out for support and help navigate some of these challenges. Dr. Cole, I want to turn it back to you and ask a little bit more specific. When it comes to eating challenges like dry mouth or trouble swallowing, usually we've talked a lot about how they happen during treatment, but can we talk a little bit more about any long-term challenges related to nutrition and eating that patients may need to be aware of?
Yeah, the one trick about a lot of myeloma therapies is that are long term. And kind of one of the big ones, and definitely one of the most common ones, is the diarrhea that is associated with using Revlimid maintenance. We've known that for over a decade, and that can be a real challenge because some people don't want to talk about how much diarrhea that they're having. And the good thing is that there's a really easy solution to the diarrhea associated with Revlimid. It's a medication called cholestyramine, or a uric acid, uric acid. I'm sorry, a bile acid binder, which can be disrupted with long-term Revlimid. And so I always, always, always ask my patients if they're having diarrhea. Some of them want to talk about it, but then when I say there's a solution to it, then they're more interested. With some of the other therapies, with the CAR Ts, and some of the T cell redirection therapies, there can be more longer term changes that can happen. Senses of taste and smell can be altered. And some of the things that Chelsea said was, completely on point. That patients will say that they have a more metallic taste in their mouths, and so sometimes avoiding, the utensils that are metal can really help with that. And so, it's not a one-time conversation where where you have only one shot. We're going to talk about kind of some of these long-term side effects. I mean, it's something that we ask every single time. Why don't I just, give a patient maintenance Revlimid and never see them again? Because even though the likelihood is that they'll be, in their remission for a very long time, I need to watch for those side effects. And some of those subtle side effects that kind of creep into your peripheral vision. And I don't want people to get comfortable with having 4 to 5 stools a day when I know that there's a powder that they can put in their water in the morning that will completely, normalize that. And so those are some of the more longer term side effects and the more common ones that we can, easily address, because again, we've been giving these drugs for like forever. I had hair back when these drugs were first invented, so and that was a long, long time ago.
Thank you so much, Dr. Cole. And again, highlights the importance of talking to your care team, to do that proactive planning, to talk about when you're experiencing symptoms and side effects and be able to manage them with your care team for sure. So thank you for that. I just want to remind our viewers that now is a good time to put any questions you have in that Q&A tool, and we'll get to those in just a few minutes. And now I want to ask a final question before we get to Q&A for our webinar speakers here. If each of you were sitting with a newly diagnosed multiple myeloma patient managing eating challenges, what are some of the few important things that you would want to tell them? And I'll let Michelle go first.
I think the first thing is it does get better. And at first, I just did not believe anyone when they said that. I thought, this is how I'm going to have to learn to live. But it does get better. And it's a long journey. You got to advocate for yourself, stand up for yourself, talk to your doctors, tell them what you're going through, and reach out to people for support. Those are the three big ones.
Thank you, Michelle. Chelsea, you want to jump in?
Yep, that was all really really important for patients. I kind of echo Michelle, advocate for yourself. Just because you're told that, diarrhea or taste changes or loss of appetite is expected, that doesn't mean that you can't get support from both your registered dietitian and physician in managing and taking action to help maybe lessen and prevent those side effects. So just be an advocate for yourself, communicate with what you're feeling and what you're doing, and ask to speak with a registered dietitian if available.
Awesome. Thank you, Chelsea. Dr. Cole?
Yeah, I guess I'll just blend those two together and say, I always tell, I've been doing this, for 20 years, and it is, definitely this too shall pass. My grandmother said that, again when I was younger, and it's true today. I make sure that a lot of these things a lot of these side effects have solutions, to make sure you communicate that, because this too shall pass. The other thing is, build your team. When you have cancer, build your team around you. Michelle got her parents. I always tell my patients, get your social worker team, get your educational team, get your nutrition team, get your social support team around you. Build your team around you. And as you go through, the journey of having cancer, because it's a marathon, not a sprint, that you build that team, and that a team you can trust, along with the doctors and the nurses that surround you, and make sure that you are the one empowered. You're the one that has all the power, and build that team and have them help you along the way. And it makes the journey much, much better than if you try and quote tough it out and do it by yourself.
Thank you so much for that. All great points, and I really appreciate all three of you sharing that, as well as sharing all your experience and insights throughout this webinar. I just want to let our attendees know that before we open up the forum for questions, we have placed on an on-screen poll so that we can hear about your experience during this webinar today. So if you could please take a few moments to submit your answers before you log off from the webinar, we would greatly appreciate it. And while you're doing that, I did also want to mention that in addition to the helpline and the resources on the Cancer Support Community website that I mentioned, there are also, as I mentioned earlier in the webinar, over 200 locations of Cancer Support Community and Gilda's Club located throughout the country that also do all kinds of nutrition and eating related programming, as well as cooking demonstrations, and offer support. So definitely, as you all are navigating this experience, the cancer support community is here to support in whatever way we can. So now let's turn to some questions from our audience. And I have a few questions here, and we're going to get through as much as we can. So thank you all for submitting the questions that you have so far. The first question, and this probably is good for both Dr. Cole and Chelsea, does protein amount and type help prevent renal and injury?
So I do think that it could help prevent in terms of if you are trending towards higher, kidney labs and, not great renal function, being mindful, because patients are typically told to eat a lot of calories and a lot of protein. However, if they're trending towards, you know, renal failure, being mindful of that. With that being said, that should be very work with your doctor and your dietitian to be very detailed on how much protein you need based on, your weight, your age, your labs, and your treatment and your history.
Yeah, myeloma kidney disease is 99% of the time associated with a protein losing kidney damage, so nephrotic syndrome, where you can lose quite a few calories through that you're just peeing out because of the renal disease associated with myeloma. And so to balance that loss is when we really get we put the nephrologist on the team as the running back. I guess I'm gonna make up something, but to have a nephrologist on the team to help us balance that with renal disease. So when we'll have people on different protein diets and supplement in different ways when they have proteinuria or myeloma kidney disease, but we always involve the nephrologist to help us with that.
Got it. Thank you both so much. And Dr. Cole, I know when we were talking about the different treatment types for multiple myeloma, you mentioned some of the newer therapies as well as CAR T. We have a question here about what can be done when CAR T has affected taste and smell.
Yeah. So one thing is that it's usually temporary. It takes a while for those cells to grow back, so it can take months for some of the taste changes in the same way with stem cell transplant that it takes time. But usually, most of the time it will reverse itself over time. So it really is kind of doing some of those things that Chelsea had mentioned earlier. A lot of times people have metallic taste, or they'll have their sense of spices change. So they may, increase the spices in their diet, make it a little bit, flavor forward. And here's your opportunity to go to Buffalo but Wild Wings and have the hotter Wild Wings in order to really get a more of a sense of taste until it kind of gets better. But I think a lot of what Chelsea said was right on point. But it is mainly and usually a temporary, but it takes time for it to get better.
Got it. Thank you. Chelsea, anything to add there?
Yeah, I think one important point that we haven't hit on yet is just also very good oral care during treatment,
Hmm.
which is a big education point by both doctors and dietitians. And probably part of one of the first things that we go through is just making sure you're taking good care of your mouth. So rinsing with usually non-alcoholic mouthwash or very mild alcohol-free mouthwash. It doesn't help 100% prevent these oral changes, but it can help if you're staying on top of your oral care, staying hydrated to help prevent,
Hmm.
dry mouth, which can make all of these eating challenges worse. So, really doing everything you can from oral care, hydration, food swaps, cooking with different textures to help manage these different symptoms.
All great points. Thank you so much. And Michelle, I saw you nodding along about the oral health. Was there anything that worked well for you in sort of managing your oral health?
I just think before the stem cell, that was really pressed home to me because of risk of infection. And then ever since then, staying on top of it for sure.
Thank you. So this next question here is about the microbiome and how and does the microbiome along with foods affect myeloma?
Yeah, the answer is yes. And we're learning more and more in very rapid succession about how the microbiome affects. So, the bacteria that live in our body just naturally, sort of the members of the bacteria affects our immune system. And of course, two things is that, myeloma is a cancer of the immune system on one end, and we use the immune system in a major way to treat myeloma. And so, depending on, and again, there's a lot of research in going into the inflammation that can be associated with changes in the microbiome and side effects of the immune therapy, and effects of the microbiome and especially limited microbiome, limited numbers of bacteria, changing the effectiveness or the side effects of CAR T therapy. And so that is really, in fact, we have a trial. We put a patient on today on a trial specifically looking at what microbiome changes, do we see with bispecific responders and people who don't respond as well. So that's a very, very active area of research. Basically, a lot of them saying that, the limited microbiome may have, more worse outcomes, and that, expanding the microbiome may be better, but we need to do more research into that. But that's a very good question.
Great, thank you. And again, highlights the importance of the research that's happening across the field and in terms of improving treatments as well as managing some of those side effects. So thank you for that. We have a question here that mentions that somebody got bile acid malabsorption from Revlimid. Can you explain that a little bit more?
Yep. So Revlimid has kind of an interesting side effect is that usually if I eat a potato chip, so I eat a potato chip and drink water, the oil in the potato chip and the oil and water don't mix. And so the bile acids help to have things, the soap that has things, to dissolve so that I can absorb the water and the potato chip. For some reason, Revlimid causes a dyssynchrony between that effect. So if I eat a potato chip, sometimes I'll produce a bile salt, but sometimes I'll just drink a glass of water and a bile salt will come out anyway, trying to do something, which can cause diarrhea. And so it causes a desynchrony. It doesn't cause any pain, doesn't cause any discomfort, but that dysynchrony that happens over usually when people take their Revlimid for a year or so can cause diarrhea. And so we use either a drug called cholestyramine, which is a powder, or a pill called cholestyramine, which simply binds up those bile salts. It doesn't get absorbed in your system, so there are not a lot of systemic side effects, but it helps to bind up those salts to help re-coordinate things so that you don't have the diarrhea. So the two medications that we start out with to make sure there are no other causes of diarrhea. Sometimes we'll try to tell patients to limit the fat in their diet, decrease the fat intake in their diet again, because that's where the bile salts come in. But then finally, that we'll try the cholestyramine or cholestyramine that they can take. And of course, Imodium can help with that too.
Great, thank you so much. And we have a lot of really great questions here, and we're not going to get to all of them, but definitely would encourage folks to speak with their registered dietitians on their care team to talk through those. I think we probably have time for maybe one more. There's a question here about, we talked a little bit about the brain fog that comes with some of these treatments. And I know, Michelle, that was a big one for you in your experience. The question here is, are there any foods or drinks that can help manage some of that brain fog?
Yeah, I think that's a great question. And I'm curious if Michelle has any personal, you know, insights or tales to this. Unfortunately, there's not really one specific food or beverage that can help manage brain fog. I think the most important kind of nutrition intervention is, like Michelle did, to kind of plan ahead and have a support system if you know that you're not going to be able to cook and prepare meals for yourself. And that could be making, a list of foods in the grocery store that require very, very minimal cooking. You can steam vegetables in the microwave. You can steam a sweet potato in the microwave. You can microwave oatmeal. These are all still very healthy things that take minimal effort and time to prepare and can still kind of help you on those days where you're not feeling well. You don't have the ability to maybe cook a recipe that you used to cook. And then also preparing meals ahead of time, stocking up your freezer, relying on friends and family.
Great points. Thank you so much, Chelsea. Well, we are out of time, but thank you so much to our speakers, Michelle, Dr. Cole, and Chelsea, for joining us today for this webinar. Thank you to our sponsor, Johnson & Johnson, and our partners, the Multiple Myeloma Research Foundation and Saber Health, for their generous support of this event. This event has been recorded and will be made available on the Cancer Support Community Events webpage. Thank you all again, and we look forward to seeing you at our next webinar.
Thank you.
Thank you.